you would please call us to order.
I'm ready, and at this time I'll call the Town of North Wilkesboro work session to order, and I'm going to lead us in an invocation. Did you say the police chief is with us?
Yes, sir.
And I'd like to ask Tim to lead us in the pledge, if you would, please.
Yes, sir.
Let us pray. Most heavenly, gracious Father, we come to you, Lord, as humbly as we know how. We just thank you, Lord, for each blessing of life that you bestow upon us, for the help and strength you bless us with from day to day. And Lord, we pray now on behalf of those that are in the need of your healing touch due to some of the virus that's going around, and even those that do not have that in the hospital, whether they're in the hospitals, rest homes, wherever. Just touch their bodies, restore them to a portion of health according to your precious and holy will. And Lord, we just thank you, Lord, most of all, for your Son died on the cross for our sins, making it possible for us to have eternal life. We pray this prayer in Christ Jesus' holy name. Amen. Chief, if you would please lead us in the pledge.
Yes, sir. I pledge allegiance to the flag of the United States
United States of America,
To the republic for which it stands,
one nation
under God,
under God,
indivisible,
indivisible,
liberty, and justice for all.
Thank you, sir. Everybody get themselves comfortable, and we'll just continue into the agenda. And the next item on the agenda is the approval of the agenda. And I'll need a motion for that to take place, please.
I make a motion that we approve the agenda as stated.
Thank
I
you,
second
Michael.
that.
I appreciate that. Thank you, Debbie, for the second. All those in favor signify by saying aye. And
Mayor, we have to, hold on, Mayor, we have to do a roll call vote, remember?
That's right. Excuse me.
So I'll do the roll call. Andrew,
Yes.
Angela,
Yes.
Debbie,
yes,
Bert,
Here.
Michael.
Yes,
Okay.
Okay. I'm still trying to get used to that. Thank you. All righty. The next item on our agenda is work items, and at this time I'm going to turn all this over to Wilson. And Wilson, you move forward, please.
Yes, sir. So the number one item on today's agenda is a coronavirus update. I'm pleased to say that Wilkes Health Director Rachel Willard is here with us to share with you an update on the status of the virus in Wilkes County, the work of her department, and to answer questions you have about the state of the virus in our area. And then after she gives her presentation and answers questions, I'd like to talk with you about my recommendations for resuming some town services. And I'll ask Rachel to stay on that call to provide us with any expertise or to answer any questions about the safety of resumption of services that we may have. But for now, I'd like to turn it over to her and ask her to share an update.
Thank you, Rachel, for being here.
Thank you, Mayor. Thank you, Commissioners, for letting me come tonight. So real quickly, in Wilkes County, we do have a total of 488 cases presently. We have 6 who are currently in the hospital, with 30 who have been confirmed in hospitals. We do have 6 deaths. We just reported our 6th death about an hour ago. And we do have 459 recoveries, with 41% of our cases living in the North Wilkesboro zip code. So I kind of wanted to talk a minute about how Wilkes County is defining recovered. We know that the CDC has not really issued a definition, so We are defining ours a little differently than the state. The state is using 14 days post the specimen collection if you don't end up in the hospital. And then if you are hospitalized, they're using 28. In Wilkes County, we're using that 10-day isolation period. It's just a little bit easier for us to keep up with as we saw our huge increase with Tyson. We decided to use that 10-day isolation measure as our cutoff point. Of course, if they were in the hospital, we're not considering them recovered at this time. We do currently have 3 outbreaks. So we have Rose Glen, which still has 3 cases. They are still active. We have Wilkes Health and Rehab. They have 6 cases and are still active. And then today we got notification that the Wilkes prison now is considered an outbreak, and they have 3 cases with 1 officer who has contracted the virus and then 2 inmates. Those 2 inmates are no longer at the prison. They have been relocated to other facilities so that their health could be managed elsewhere. We do now have something what we're calling clusters. So I'll explain the difference between an outbreak and a cluster here in a second. But as we know, we have Tyson, which has reported 570 cases. And then additionally, this week, we got notification of a work site that now is in a cluster. And they have 6 cases of coronavirus reported there. So basically what an outbreak is, those are our congregate living facilities. So that's a long-term care facility, a nursing home, a prison, a jail. If we had a dorm here on a campus, that would be considered congregate living. Then their definition of an outbreak is 2 or more cases within a 28-day period. So if I'm on day 27, like if Wilkes Health Rehab was on day 27 and they get a case on that 28th day, they have to start over and they're still considered in an outbreak, and that 28 days continues. For clusters, those are 5 cases with illness onset or an initial positive within 14 days, and I have to be able to link those solely to that setting. So it couldn't be a person who contracted it from a close contact, maybe in a household. It has to strictly come and have a linkage to those people physically, either at that workspace, at a child care facility, at a church, whatever that setting may be. So that's where we've kind of lumped in those meat processing plants, our child care centers, churches, which we haven't had any of those yet. But if we do, it will be considered a cluster. And we haven't been able, I know there's been a lot of speculation as why we haven't released any numbers with Tyson, and we kind of waited for them to do that. However, under North Carolina communicable disease law, and that general statute is 130A-143, we're not allowed to release that information because place of employment is considered PHI. So unfortunately, we haven't been able to release anything around that. Or when we thought we might have a daycare center that had an outbreak, we weren't able to release anything around that or confirm that either. So that doesn't change anything. We are reporting jails, prisons, nursing homes, or any other congregate living facility. And that's simply because the health department has regulation authority over those. So that's why we're able to report those, and why we can't report things like Tyson or a work site or something to that extent. Let's see. We are continuing to do Walmart testing. That is funded through the United States Department of Health and Human Services under the White House Task Force testing rules, and they follow the same rules that we follow in North Carolina. So basically they are here Monday, Wednesday, and Friday from 7 to 9. So far, they've tested 223 people, and we've had no positive results come back yet. So that's a really good sign. The goal for the Walmart testing is to test 90% of the population in a 10-mile radius. Also, the governor announced today that CVS is going to be doing some drive-through testing. There's going to be 55 sites across the state. We do not have one of those in Wilkes County. And I'm thinking that's simply because we have Walmart who's here to help us increase testing measures. I did kind of just want to go over the latest guidance for testing in North Carolina. So there's a difference between what a commercial lab can do and what our state public health lab can do. So if we're using like LabCorp or Quest, or if the hospital is using their in-house labs to do testing, they can follow a little bit different criteria than what we send off to the state lab. So if we're using a commercial lab, It can be basically anyone with symptoms, a close contact to a positive, regardless of their symptoms, those who are at high risk of exposures. So again, that would go back to our congregate living, like long-term care facilities, jails, and prisons. People who are at high risk of severe illness, so those with underlying health conditions like diabetes, heart disease, immunocompromised, those people fall into that category. And then people from historically marginalized populations. And if you're a healthcare worker, first responder. So those all kind of, regardless of your symptoms, you can be tested as long as we do those through an outside lab. So Walmart, for instance, is not following those guidelines. They're following the guidelines I'm about to go over. But if you were to go to your private practice and they're using LabCorp or Quest, as long as you meet one of those criteria, they are able to test you. So at the health department, we are using LabCorp and the state lab. And in order for us to use the state lab, you do have to have symptoms currently still. You have to either be hospitalized, be a healthcare worker or a first responder, live in a congregate living facility, be uninsured, be at high risk of severe illness, or if we have a deceased person who we think might have contracted COVID-19, but we weren't able to collect a specimen from them prior to their death, we can also send that to the state lab. So that's kind of the high level Wilkes County snapshot as of 5 o'clock this afternoon. Any questions?
Tyson,
I'm sorry, Mayor, what did you say?
what was the total you said? Was it Tyson? I'm sorry.
570.
Okay, thank you.
You're welcome. And that's not all Wilkes County residents.
Right, I understand, yeah.
Okay.
Probably more out of the Guilford and, well, Greensboro and Winston area, probably.
So what we saw is about 50% of those results were local, and then those others impacted about 12 other counties in our
Okay,
state.
thank you.
You're welcome.
Hi,
Mayor,
ma'am.
Heather Dean has raised her hand and would like to ask a question if you are okay with that.
Sure.
Yeah.
Hold on, Heather, you are muted. Hold on. There you go.
Okay, so you said that we don't have an outbreak at one of the daycare centers now?
No, we do not. So they will technically be considered a cluster, and they have less than 5. So they will not be considered a cluster at this time.
Okay, but there are still cases. There were positive cases.
There were at Double Trouble.
Okay, got you. All right, thank you.
And they come off of their 14 days today, actually, and they're opening back up tomorrow.
Good, good, good. Thank you.
You're welcome.
Hi, ma'am. This is Commissioner Palmer. How are you?
Good.
Thank you for coming today. I had a few questions. You said we're going by 10 days, I guess, for someone to be considered recovered. Is that, if someone has it, is 10 days enough for the virus to run its cycle and then not be contagious or sick anymore?
So we decided to go off of the 10 days because that's what the CDC guidance is for those who are a positive case with COVID-19. I think the studies are still showing that some people are ranging anywhere from 3 days to 28 days, but technically the guidance to come off of isolation is 10 days. So that is why we decided to go with that recovered figure. So it's kind of a little, I don't like to necessarily look at the number of recovered simply because it's not an evidence-based figure, but we do want people to kind of understand that we have about 20 active cases left in our community that we're closely monitoring through our contact tracing. So that figure, you kind of have to take it with a grain of salt. But like I said, we chose just to use that 10 days since that's what the CDC is using for their isolation.
So can
Rachel?
someone
So-
be contagious and still go out in the community after that 10 days or?
So maybe I left this out, and this is a huge point, and I'm sorry, Commissioner Palmer, this is my fault. You have to be 10 days post first your onset of symptoms and 72 hours fever free. But if you were still showing symptoms on day 11, you technically would not want to go out into the public. We give you that general guidance, but we're not following up with every single person on day 10. simply because we're over almost up to 500 cases right now, and that's a little impossible. But we do give out guidance that says if you're still showing symptoms on day 10 or 11, or you still are having a fever, please do not go out. Your isolation order is in effect until you are 72 hours post fever.
Thank you. My next question was about the nursing homes. What is the process there to keep it from spreading and getting into the nursing homes? Because I know that's a real concern.
Yeah, so we have been working closely with them, and basically since the beginning of March, most of our nursing homes in Wilkes County have not allowed visitors into their facilities unless it's for end-of-life care or a rehab person who may not be on staff but is a contract staff worker. And so most facilities have isolation halls. So if someone starts to show symptoms, depending on which facility it is, they may have 4 beds or they could have up to 14 beds. And they are moving the resident to that hall to monitor their symptoms and test them. What we have seen so far with our outbreaks, whether it's at Rose Glen or Wilkes Health Rehab, is a staff person has brought it in, simply because usually they are moonlighting at whether it's the hospital or another facility. And while we encourage them not to do that, we can't require a facility to say, no, you can't do that. But they are taking temperatures of their employees before they come to work. They have increased hand washing. They're only working on one hall. They're not letting them cover 2 different halls anymore. The cleaning crew is again stationed just in one hall. They've stopped congregate meals. A lot of them have not even let the residents come out of their rooms currently right now either. So they're kind of just having to communicate across the hall to each other or kind of stand at their door, which is kind of sad. Activities have been limited. They've increased their disinfectant measures. So we have worked with them on making sure all of their cleaners meet the EPA regulations. And Angie Rhodes, who's our environmental health specialist, if there's any questions, they call her and they are able to get those answered right away.
I had one more question about that. So if someone there has test positive, do they take them out of the home to the hospital or somewhere else?
Not necessarily. If they're able to manage the care on site, they will. They'll just do that from that isolation hall. We've actually only had to transport 1 positive case out to a hospital from a nursing facility. I do know at one point in time, Wilkes Health and Rehab was accepting COVID patients in from the hospital, which that was a corporate decision, not a local decision. And at that point in time, if they can manage those symptoms there, they will accept a COVID patient into the home. But unless if a patient has to be transported out, they're trying to treat them there.
Is that smart and okay?
Yeah, that's what the guidance recommends, simply to help kind of limit the exposure. And, it'd be no different if it was you or I who had COVID at our house. We wouldn't necessarily be sent to the hospital either unless if our symptoms weren't managed. So what we found is by them isolating them on the hall, they're able to maximize their PPE and staff time to kind of limit cross-contamination and exposure there.
Yeah, but the difference between me and you is we're not in the high-risk category, and about everybody at the nursing home is. I mean, you see what's going on in New York and places, and I just don't want to see that happen here if there's anything we can do. I know that the board doesn't. I would encourage you to be tough on that stuff. Thank you for everything.
You're welcome.
Rachel, this is Wilson. I have a question going back to the recovered statistic.
Mhm.
It sounded like what you described could possibly create a scenario where someone is counted as recovered but is still experiencing symptoms and still needs to isolate. Is that true?
It is true. That's why I kind of said that number, we really were hesitant on posting it anyways, because you have to take it with a grain of salt and it's just one piece of the pie. But we really stressed to those positive cases, if you're still on day 10 showing symptoms, or if you still have a fever, you need to wait till you are 3 days fever free before you go out into the public. I do have the authority to issue a formal isolation order, which we have not had to do on anyone yet, but we can't, even if Wilson, you were diagnosed with it, there's no way for us to enforce that you're staying at home 24/7 either. So we're just hoping and praying that people are following our rules. We've had a few that we've considered it on, but we haven't had to take that extra step and measure to move to the next step.
Thank you.
Mhm.
Okay, Heather.
So now,
Yes.
okay. So you mentioned going to that next step. We've had several people contact us in the newsroom because they are essential workers. They've been at grocery stores, at auto parts stores, and they've all had stories about somebody coming in and saying, well, I got tested for that. They say I'm positive. I feel fine. So I'm just out running errands and I'm fixing my car and I'm doing this and I'm doing that. What is that next step? And is there anything that anybody can do when they're put in that situation with an asymptomatic person who's just out and about, not staying at home in quarantine?
Yeah, so we've gotten calls from some people where we have been notified of a positive case being out grocery shopping or pumping gas, whatever it may be. And we've been able to handle that through local law enforcement, luckily. But let's say, for instance, we had a non-compliant person. The general statute gives me authority to issue a true isolation order, which we do with any other communicable disease, tuberculosis, HIV. Those are the main ones we've issued them before. And that's a whole legal process that we have to go through that Danny may be able to explain better than I can. But essentially, we issue that order to them with help of law enforcement and then rely on our local law enforcement agents to help us enforce that.
Okay. Thank you.
All right. Any other questions or comments for Rachel?
Rachel, this is Jimmy Martin, Chief of the Fire Department in North Wilkesboro. Can you hear me?
I can.
I am getting a bunch of calls about businesses opening and what they should do and what they shouldn't do. And the state's not really put out, I know they put out restrictions on what we can and can do, but they've not made them as strict or not put out what I think should be total distancing, or how many people should be in the stores or beauty shops or barber shops. What is your guidance on that?
So, Jimmy, I think the executive order did cover capacity in businesses, in grocery stores and restaurants, if I'm not mistaken. Danny, can you verify that for me?
There we go. That's correct. The executive order does have capacity limits for different types of businesses, particularly restaurants. I don't have it directly here in front of me, but from memory, roughly 50%. And there's fairly specific guidance as to what barbershops, nail salons, beauty salons are supposed to do.
Yeah, and basically, Jimmy, if someone called us to ask if it was, we would direct them to the CDC website for the business guidance on reopening, and they have a nice matrix that kind of helps you lay out whether or not you should open or not. But if there was a specific case of a specific scenario a business wanted to walk through, we would probably direct them to Angie Rhodes at Environmental Health. She's kind of taken the lead for us, and she would be able to help them walk through those specific examples and talk through the cleaning and disinfectant and what type of shields you may need to purchase, because there are certain ones, I think the plexiglass you can't use the disinfectant on, but the glass ones you can. So she can help any business work through any of those details.
Well, I just think we all need to be on the same page, because I don't want to tell one owner of a business that you can do this and tell another that you can do that. But just think we all need to be on the same page.
Rachel, this is Joe Rankin. I have one question, please.
Oh, go ahead, Joe.
I'm sorry, Ms. Day. No, you go first.
No,
please.
no, my question to Rachel was, since our phases have changed and we're out and about more, do you expect an increase to happen in the next, say, 2 to 3 weeks with opening up more? Is it something we need to be watching for or considering?
So I think that's a fair question. I think it's kind of hard to say if it's going to be due to just opening up or knowing that we're trying to increase capacity in testing. So more people will be actually getting tested. So we'll be able to identify more cases out in the public. The state's goal for every county is to test 5% of the population. So I think it's going to be a combination of both. And I do anticipate a small rise again. I think we're going to kind of have like another, what I'm calling a second peak. I don't think we'll see the numbers rise as quickly as we did in the past 2 weeks, but I do anticipate another bump of maybe 20 to 50 cases in the next 14 days.
Thank you.
Rachel, Joe Rankin. On the outbreak at the prison, contact tracing, are y'all doing that as far as let's say a prison guard has a family member and he may have been exposed inside the prison? Are y'all looking at that?
Hey, Chief Rankin. Yeah, Diane has been in touch with the nurse there. So what we are doing is working closely with her and the regional nurse to identify contacts through them, and then we will reach out. But my understanding from the little limited knowledge that I got this morning when we were talking about it is that they do not live in Wilkes County. So technically it will not be our health department who's doing the contact tracing for that staff person. It will be the health department of that county who will be doing it.
Okay, since it is in an enclosed facility, is that something that should be a concern?
I haven't talked to Diane, so I'm not sure if we're going to mass test over there or not yet. We did offer to take more test kits over. They had 6 on hand. I think that they have isolated the bunkers of infections and they are watching them closely. I don't know how that prison is really set up and how they operate. But from my understanding, what Diane told me earlier today is that they had a pretty comprehensive plan in place and they had already been working with the state since they had experienced several outbreaks elsewhere across the state. So they had kind of had lessons learned and started implementing other measures prior to this. I'm sorry I don't have any more information. It kind of all happened quickly and I'm trying to take off today and tomorrow, so I've been a little out of touch with what the fine-tuned details of everything that's happening over there.
Okay, thank you very much. And thank you so much for all that you do to keep us safe.
All right, any more questions or comments for Rachel?
I've got one more quick one. Rachel, this is Commissioner Palmer again. To follow up with what Joe was saying about contact tracing, what kind of resources do you have to do that, and do you have enough?
Yeah, so I think it's kind of ever changing. I think when Tyson hit, we saw this huge explosion of cases that we were going to have to follow up with. And essentially what we did is we pulled every single staff member from the health department that we could to keep operations going, but then also do contact tracing. So I think at one point in time, we had 24 staff people doing contact tracing. Then I recruited the school nurses, which luckily were able to step in. So we are still working with 10 school nurses right now. We have 2 full-time nurses that are working on it. And then starting next week, the Community Care of North Carolina has set up a resource for us to use through the state, so that 250 new contact tracers that the state keeps talking about over and over again, that's that CCNC group. And we're going to have access to those contact tracers to help us. They may not be local Wilkes County residents, but there's a system in place that we can phone them. They have access to our system and to our people, and they reach out to them for us. But we still anticipate maintaining 2 people internally doing that every day. But I think right now that we're kind of over the hump of Tyson, we're able to keep up and maintain what we're getting in on a daily basis.
Thank you, ma'am.
Rachel, this is Mayor Johnson again. I would just like to say to you and the board of commissioners and anybody else that's listening, I really believe in our mayors and managers meetings and meetings that we've had between the towns and the county and with Tyson. They are trying to do everything that they can, working hard, very hard. And I think I give them a lot of kudos for all the efforts that's going on to make sure that the processing of the chicken that we get, and we've got to have that going on. I just want to go on record to say that they're doing everything they can to make everything safe over there, and I appreciate it very much.
Yeah, and I will just add, so the board's aware, we did bring in the CDC and the North Carolina Division of Public Health Occupation of Environmental Epidemiology to come do a site visit about a week and a half ago. And out of all the plants across North Carolina that they have visited, they said that our Tyson facility was the best equipped to handle it and had the most permanent solutions. So they got really high remarks from the state and the CDC. I've been very pleased with everything that they have done. I know it doesn't necessarily always get mentioned in the media, but they really have worked hard to protect the safety of their team members.
Absolutely. Thank you, Rachel.
Rachel, this is Jimmy Martin again.
Yes, Jimmy?
Are all the fire chiefs or fire departments getting a list of where this virus may be as far as addresses?
So the addresses are in the CAD system. We're not handing them out directly. So if there's a call, first 911 screening them, but if they are flagged in the CAD system, I know y'all are looking at going back out and responding to calls, you will be notified of that.
Okay, that's what I need to know. I appreciate all of your hard work and what y'all do.
All right. If there's no more questions or comments for Rachel, I want to move on to the next portion of our conversation here. And that is a discussion about a resumption of town services. So as you know, for the last 10 weeks or so, we have been operating with reduced staff. In the middle of March, you all gave me the authority to make operational changes that were necessary to help fight the virus. The first one I made was I sent non-essential employees home and asked them to stay there. They were compensated 2/3 of their normal rate. Some of them were called back in on a few occasions to fill in the gaps for essential employees that had to be out. But more or less, we've been operating with a reduced workforce for the past 10 weeks. And we did that to do our part to break the chain of transmission. With fewer folks out and about working, with more folks staying at home, we could contribute to fighting the virus and breaking the chain of transmission that way. And we talked at the time about the impacts that would have on some services. But since then, I've heard from you all and I've heard from constituents about their desire to resume some of those services. So I want to have that conversation now. On the flip side of that, we're also approaching a critical time where we need to make some decisions about services and events that are scheduled to take place over the summer and whether we should continue with those. But before I go any farther, I want to make two sort of contextual remarks here. The first is, as I alluded to before, you all gave me this ability back in March. And so today what I'm bringing to you are recommendations. I'm not necessarily asking for direction. I'm bringing you recommendations that I want to hear your thoughts on. And the second is I'm still taking a very strong public safety posture. As you've heard from Rachel, the floodwaters have not crested yet. They're definitely not receding. And so this is still a very dangerous situation. And I think that we need to keep that in mind as we consider what to do with our services. All right. First of all, That approximately 1/3 of the workforce who's been on stay at home, I'm recommending that we bring them back to work on Monday. Now, I want to clarify, I'm not talking about people who are at home because they're sick or they've been exposed. I'm talking about people who we electively sent home a couple months ago to fight the virus. Those are the people I'm going to bring back. We do have a couple of employees who've had close contact with people with the illness, and so they're isolating at home and they're going to stay there. But these other folks who've been at home, we're going to bring back on Monday. When they come back, they're going to see some additional safety measures that the various departments have implemented. And I'm going to send out a document that lists those after the meeting. And some of those things are temperature checks, health checks, changes to functions to promote social distancing, a requirement that they wear PPE when they interact with the public, and some other measures that I'll send those out. But they'll be able to come back and, if they follow those measures, return to work. That means that some of these services that we've had on pause for the past 10 weeks, such as landscape management, the Green Thumb crew, collection of bulky refuse and yard waste collection, will be able to resume. Now, they're going to be behind schedule and it'll probably take them a few weeks to catch up. And so it's not going to be business as normal for them, but they'll be back at work and they'll start making a dent on that backlog. The Wilkes Farmers Market is not necessarily a town service per se, but they use our property. And so we have a lot of say over whether they can proceed or not. They're going to be given a chance to reopen, but only after I approve a written safety plan that Rachel has agreed to consult me on. And I know that they've been working to create that plan. So I think that they'll be able to submit something that's acceptable, and we'll be able to let them open here in the next week or so. Crystal's been working with them on that. And so Crystal, if you wouldn't mind sharing a little bit about what that plan includes.
Okay, so they got guidance from several different places, USDA, ASAP, RAFI, and some other area farmers markets have opened, like in Watauga, Ash, Elkin, pretty much separating their vendors by at least 10 feet, which they normally would be anyway. Encouraging people shopping there to only have one family member, to encouraging our vendors to wear masks. Every vendor will have hand sanitizer available and will sanitize their area every 30 minutes or so. We'll have signs around encouraging people to social distance. There will not be any sampling. We won't have any music, and people will not be able to touch the produce, but simply point to what they want and let the farmer bag that up for them.
Okay, thank you.
Mm-hmm.
So once they write that down and submit it to me, and Rachel and I are able to review that, we'll probably give them permission to go ahead. We're going to resume public access to town hall, but by appointment only, and will require visitors to observe additional protective measures that are listed specifically in the document that I'm going to send out later. And then finally, Rachel alluded to this one before, North Wilkesboro Fire Department will resume responding to medical calls that are cleared by the dispatcher. For the past month or so, Wilkes EMS has been handling every first responder call because they're better equipped to handle COVID-19 patients. They've got more PPE, a little bit more training in that area. And so in order to minimize the risk to other first responders, Wilkes EMS has been responding to all those calls, and they're swamped. And I'll take a moment and say that I want to recognize them for all their work. Their workload has been huge. Not only have they been responding to coronavirus patients, but they've been responding to additional overdoses and falls and heart attacks and all the things that come with people staying at home more. And so they've been working heroically, and I want to recognize the work that they're doing. And because of that, they're ready to give some of that back to the other first responding agencies. And we have agreed to start running first responder calls again, with the condition that the dispatcher screens the calls and only dispatches our crews to non-coronavirus related situations. So the dispatcher will ask a series of questions to try to decipher whether the call is for a patient with coronavirus. And if it's not, then they'll perhaps dispatch one of our crews. I think that this is the right move because we've taken steps to minimize the risk to our folks. But also I think that this is a better service to North Wilkesboro, because if you have to wait for a Wilkes EMS ambulance, there may or may not be one close by. They don't have a static base that they respond from. They're all over the county. So depending on where they are, their response time might be higher than you need in that emergency situation. But we know that with our crews responding, they're only a few minutes away. So I actually think that this is a better deal for the people of North Wilkesboro. So you can see here on the screen, I pulled up a summary of services that will resume. That's on the top of the page here. And I'll pause here for any questions or comments on resuming those services.
Wilson, this is Debbie, and I'd like to say I think people will really appreciate the changes that you're making, and they seem reasonable and sensible, and people should be able to be relatively safe. And so I'm glad we're able to move this direction.
Well, Wilson, this is Jimmy.
Yes, sir.
And I didn't go to the association meeting 2 days ago, but I was told that EMS is only going to page us if just necessary. So if it's something major, we'll go. Rex, CPR in progress, something like that, we will go, but we'll go when we are paged.
All right. Thank you, Jimmy, for that clarification. All right. I want to move now on to changes to services that will remain in effect through phase 2. And when I say phase 2, I mean phase 2 of the statewide reopening as defined by the governor's latest executive order. It's scheduled to run through June 26th. And at the end of that period, we'll reassess these changes that I'm about to go over now. One of the noticeable changes is that all recreation facilities, that includes recreation centers, playgrounds, playing courts, picnic shelters, and public restrooms will remain closed. Playgrounds in particular were called out explicitly in the governor's executive order, and so those must remain closed. The others are permitted to open, but there's high requirements and high standards for keeping those clean, and we think it'd be better to have a uniform approach and to just keep those closed for now. Town hall will remain closed to walk-ins. Like I mentioned before, it'll only be open to people who have an appointment. We'll continue to accept utility payments and to do other business at the walk-up window on Main Street. I recommend that we continue to hold virtual Board of Commissioners meetings through June, but we can talk about that a little more when we get to the second item on tonight's agenda. And finally, we'll cancel all the concerts on the deck that are scheduled for June. The governor's executive order prohibits outdoor gatherings of more than 25. And so those fit in that category. So we couldn't do those in June, even if we wanted to. So those are the changes I recommend we keep in effect through June. And I'll pause for any comments or questions on those.
Wilson, this is Andrew.
Yes, sir. We lost you there.
Oh, I got muted. Sorry.
There you go.
I had a couple comments about the first section, not necessarily the second one.
Yes.
One thing I was just going to tell Jimmy is I would encourage you when you guys are going out to these calls, even if they're screened, I would still take precautions as if someone could have the virus. Also with the farmers market, I'm glad to see that that's going to be opening. And I would like to encourage that we don't put any restrictions on them that they don't have at grocery stores, because they're already outside. They're going to be spaced out. And I feel like that it should be as safe as going to the grocery store. So just wanted to kind of toss that out there.
Andrew, this is Jimmy. I want to let you know that we're wearing PPE on all calls that we have now, whether it's fire calls or first responder calls, gloves, and if we need them, Tyvek suits and masks. So that is one of the stipulations I put in place.
That's good, Jimmy. Good here.
Okay.
All right, I'm going to move on to changes that I recommend we make through the rest of the summer. Now, these are things that, depending on what phase the state enters into at the end of June, we might not be able to do anyway. But I think with our situation here, our case count that's still high, knowing what it takes, the cost and expense and logistical effort that it takes to do some of these safely, that we should cancel these events throughout the course of the summer. So I'm recommending that we cancel the concerts on the deck through July and August. As we know, mass gatherings are a prime spot where the virus can be transmitted. So those are high risk activities, in my opinion, even through July and August. That would include the July 4th festivities. And I can report to you that the agency that sponsors those has already decided to cancel. So that hasn't been announced publicly yet, but that's a decision that has been made. The town will not close roads or otherwise accommodate any other mass gatherings. So the cruise-ins and so forth that we don't necessarily sponsor, but that we permit, we will not permit those throughout the summer. And then the big one, this is probably the most noteworthy. I recommend that we do not open Smoot Park Pool this summer. There's a couple reasons for that, not the least of which is it's hard for people to social distance at a pool. And so that's just a high risk area that I think that we can in good conscience open up. So that one was a hard decision to make. I was sad about that one. I was hoping to go there some this summer with my youngsters, but I think it's the prudent thing to do. And Nelson and Rachel agree. So
Wilson, have there been any decision or any conversation about the Apple Festival?
So I'll ask Crystal to weigh in here, but last time we talked about this, I asked her to make sure that they don't make any big commitments in terms of booking people or spending money until they consult with us. Rachel mentioned to me earlier that she's also a little leery of that festival. And so we need to consult with them before they make any big commitments and talk here in the coming weeks about whether that festival should proceed. Rachel, is that fair?
Yeah, I think my big concern is with the amount of people that come in such a close quarters, and this thing could be gone by August and we don't have anything to worry about. But I think making a decision to either cancel it or keep it right now is a little premature.
Okay, I just want to make sure that somebody was looking into it. The fire department in North Wilkesboro has a lot of things we need to do to get ready for it. And we go down and patrol the area along with PD, but I just didn't know where we stood on it.
Crystal, if you can share your most recent information with them.
So the most recent information is probably from right before we actually went out. So it's been a few weeks. I spoke with Bob Laney, who was former president of the Ruritan Club, and they were not taking vendor applications. So they had not put anything on their website indicating either way, so that they wouldn't be collecting them. They're just kind of waiting, I think, to hear what restrictions are on crowd size and things like that. But I feel like they'll have to make a decision probably by July.
All right, maybe we should get with them here in the
Yeah.
next few weeks and talk that one over.
Yeah.
All right, so Jimmy, that question actually segues nicely into the next category, and that is what we should do beyond the summertime. So we still have some concerts on the deck scheduled for September and October. Meredith's got some planning board and board of adjustment activities that she needs to do over the next few months that might need to be in person. And so I want to take y'all's temperature, pardon the pun, on what you think our position should be on things heading into the fall.
Wilson, this is the mayor. I think we need to kind of wait and see how this thing is going to transpire, getting that deep into the year. Right now, the way it is, I think we're taking all and making all the precautions that we need to, but as time moves forward, as Rachel has said, maybe this thing will smooth out to where we can possibly have those activities, and I would be in favor of it if everything is a-okay with the virus being what you say, gone or out of the picture, so to speak. But other than that, I think we need to be very careful about how we make the commitments in September and October.
Yes, sir. Thank you.
Wilson, this is Debbie. And I agree with the mayor that September and October are a little unknown right now, and that we need to wait and see what the facts are, what the health department, the CDC are recommending, the governor. And we would all wish we can have kids at the Trail of Treats for Halloween, but we just really don't know right now how things are going to proceed. So I think caution is the right move.
Thank you, Debbie.
Hey, Wilson, this is Andrew. Can you hear me? Okay. One thing, I had a question, but before I get to that, I've had a couple people from the community reach out to me about the fireworks at the 4th of July, I guess, because they'd seen a post on Facebook where it was canceled. But to be clear, that's not our decision. That's a different organization. That's the law enforcement.
Yeah, fortunately, they've helped us out by making that decision for us.
I would hope that the media would make sure they cover that, because otherwise we're going to get a lot of phone calls about something that we're not in control of.
But I can tell you that that decision is in keeping with the trends across the state. All the other small towns that I've heard from have canceled those events. So I think that if we had been left to make that decision, I would have recommended canceling it.
Yeah.
Well, this is Jimmy again. I have to agree with Andrew that I've got several phone calls about the fireworks display, and they think the town's canceling it. I think it may be something needs to be put out that we're not the actual one that's canceling it.
Andrew, you had one more?
If I can remember, I agree with what Robert and Debbie were saying. I think it's too soon for like September, October stuff. I mean, also, you know, you got to kind of see what the state, I guess, or what happens with the schools. I mean, if kids are going to be in school, then, you know, it may change things too. I don't know. I think it's too soon, but if things do kind of go our way, I mean, we should try to do anything we can, but we just don't know right now.
Thank you, Andrew.
Yes, sir.
This is Commissioner Day, and I'd like to just say we have to do what is best for everybody's health and safety.
Right.
And I would love to see the fireworks. I would, you know, it's something that we all enjoy, but we're going to have to make some hard decisions that keep people safe. And I think that's where we need to focus our attention on.
Thank you, Angela.
All right. If there's any more comments or questions on that, I promised Rachel that we wouldn't keep her the whole time. And so if you've got any other comments for her, please ask those now so that she can sign off.
Nothing other than thank you very much, Rachel. Great job.
Thank you, Mayor.
Thank you, Rachel.
And I
Rachel,
officially, oh, go ahead. I'm sorry.
I'm sorry. This is Dale Shoemate. I've got a quick question.
Yeah.
On the testing, you said they was hoping to do 90% of the community. Is that correct?
So on Walmart's materials, we as the health department don't have anything to do with it, but on the information that they gave us, it states that they want to test 90% of the population within a 10-mile radius of the store.
So they are not going, you don't have to meet the same criteria to be tested at Walmart as you do the health department. Is that correct?
So they are using a commercial lab. So they do follow the same criteria that the state has issued to all of our clinicians. But no, if we were going to send it to the state lab, they are not using that criteria. They are using the commercial lab. So basically, if you're a close contact or if you're a high risk individual who's in a congregate living facility, if you're of a historically marginalized population, or if you're at risk of a high severe illness or a first responder, or if you have symptoms, you can get tested, is my understanding.
Okay. With that criteria, will that cover 90% of the population?
You know, I don't really know the answer to that question. My answer would probably be no, if I had to guess, but that's what their goal is and their mission is trying to accomplish. So I don't really know how they're policing it. I know you go online and you sign in and you fill out a questionnaire and then you can pick an appointment time. So I haven't actually gone through the process of doing that yet. I'm not sure what their screening system looks like.
You know, I was just curious because I've got several employees that may want to be tested. I'm also asked by the citizens every now and then about testing. But thank you for the answer.
Yeah, and I think the town actually has that information on their website about how to get tested at Walmart. So does the health department. I know the town of Wilkes-Barre does as well. So I think it's out there. I don't know the exact link off at the top of my head, but it is posted on all the public official websites.
Okay.
Yeah, I think your people would qualify.
Okay.
Your folks that have had close contact and so forth. All right, so one more, Rachel, before you go. Heather has her hand up. Heather.
Oh, I was just going to say earlier that for what it's worth, a lot of community theaters have canceled all of their summer shows. We at the Wilkes Playmakers have canceled our high school theater school, our high school directors, our kids theater. Our first show isn't even until October, and that's still tentative for anybody wondering about how our scheduling is going on. So I just want to throw that in there with you, backing up your programs and stuff, that it's not just, you know, a lot of county things. It's a lot of community theaters are doing the same thing as well, just to make sure that people stay safe.
Wilson, this is Andrew. I have one more quick question for Rachel.
Sir.
Rachel, thank you so much for all you're doing and for coming to the meeting. Is there a statistic on, it says we've had 6 deaths. How many of those have been at the nursing homes in Wilkes?
We've only had 1 death related to a congregate living facility. It wasn't necessarily a nursing home. It was Rose Glen. So that's kind of a residential senior living facility, but it is classified as a congregate living. But we have had no deaths from a nursing home outbreak yet.
That's good news. You see so much on the TV and the news, and there's so many facts thrown at you. I know that I've seen them talking about some of the states that had COVID cases going back to nursing homes, and they thought that was a bad idea. And just want to make sure we're doing everything we can to protect those at high risk. But thank you for all that you do and for coming to the meeting.
Thanks. And I will tell you that our nursing homes have been really proactive, and they're well equipped to handle these things. We work with them on their norovirus, which is almost just as contagious as this. So they've been pretty well equipped and willing and eager to jump in and do whatever we've asked them to do. And then lastly, before I leave, to the mayor and Wilson and Jimmy and Chief Rankin, I do officially go back to the office on Monday. So you can feel free to bother me at any hour at that point in time.
Thank you, Rachel.
Thank you. Rachel, appreciate you being here.
Yep. Thanks, guys.
All right.
Thank you, Rachel.
All right. So anyone has any, if no one has any additional comments on that, I'll move us on to the next item on the agenda.
One more thing, Wilson.
Yes, sir.
So we're going to be, oh, by the way, this is Andrew, but you know, but they're gonna start the mowing and the trash pickup again. What about, like, I would like to know if you can give us an idea, and I would kind of like to see us be able to start handling more things that go beyond the scope of the coronavirus, I guess, as far as like the splash pad. I know the pool's not open. Maybe it's a good time for them to be finishing that. And, you know, some of those the building downtown we need to sell. Is there any updates on any of that stuff?
Yes, sir. I was actually planning on bringing the real estate policy and some of those matters back at our next work session. So I was hoping we could get back to normal in terms of our policy discussions in June as well.
Good news. Thank you.
Yes, sir. All right, so I'm going to pull back up on the screen the next item on the agenda. And that is to talk about our virtual public hearing policy. I guess I should have called this our virtual public meeting policy. We've been doing it for a while now. I think that the things that we do are in compliance with the new statute that governs virtual public meetings. But we've also seen the trade-offs that legislation requires, namely the 24-hour comment period after a public hearing. The approach we took last week when we met was to recess the meeting and reconvene the next day after the 24-hour period had expired to take final action. But we don't have to do it that way. We could wait until our next scheduled meeting to take action. And frankly, there's some pros and cons to doing it that way. One of the pros being that it gives the public more time to weigh in, to call you and share how they feel. It also doesn't mess with you all's schedule as much because it doesn't require you to clear your schedule 24 hours later to take final action. So I wanted to hear your thoughts on that. We do have a significant public hearing coming up at our next meeting, and that's the budget public hearing. And so the question, we had scheduled action for the next meeting for that anyway, but I wanted you all to share your thoughts on that and how you'd like to approach the public hearings on the virtual meetings going forward.
Wilson, on this upcoming public, we're going to have to keep it the way we've been doing it because we have to take action on this budget prior to July the 1st. So especially on this upcoming one coming next week, we probably ought to just continue the 24-hour period, come back the following day, and take the action on it so that we can meet our statutory obligations for submitting the budget to the state.
We would have the opportunity to vote on it at the workshop that's scheduled later in the month, but that would be cutting it really close.
Wilson, this is the mayor. I'm in agreement with Michael on that. I think we need to go ahead and do it that way.
Okay. There is a caveat to the virtual public meeting policy. That is, the rules are a little bit different for the planning board and the board of adjustment. And I'll ask Meredith to share what those challenges are here shortly, but I'll summarize them by saying that you essentially have to get permission from all the participants in that hearing, and that includes adjacent property owners and others, to have it virtually. And so all those nuances together make it really challenging to hold a virtual planning board and board of adjustment meeting. And so we've been talking this week about safe ways we can hold in-person meetings for them in the coming months. Meredith, if you'll share a little bit about what you've been working on.
Sure. So the planning board, I've talked to every single board member and they're willing to do whatever we need to do to keep things on track. I've got potentially 2 rezonings and a conditional use permit. The planning board would hold a public hearing much like the governing board does. We would have to do the 24-hour comment period at least, if not more. But the board of adjustment is a lot trickier because that is a quasi-judicial hearing. So that's where we'd have to get every single property owner, because essentially there could be damages, there could be some other legality problems that we don't want to run into to essentially be in violation. So those meet the conditional use permit, quasi-judicial, kind of like court, just a lot scaled back. So those are something we're going to have to work out, and that might be where we have to meet in person and keep it all spaced out. So that's something we need to figure out. Does anybody have a question?
Meredith, do you think that following the North Carolina judiciary guidelines, because if I'm not mistaken, the judiciary is not currently having open court at this time. So would you not be able to also, with your board of adjustment meetings, kind of keep it by saying, well, you know, we're following the judiciary's guidelines, because since it's quasi-judicial, you do have those same types of, you have people that have to be sworn in, you have to have, you know, witnesses and statements, and everything has to be factual based. And so you might be able to postpone anything that's coming up just because the judiciary has postponed most of their stuff.
Can I interject on that point? We're starting court back next week. The Chief Justice is allowing us to reopen most of the court system. We're not holding jury trials, but the court system is trying to get back up and running again. I think that the issue with the Board of Adjustment hearings, you have an issue of who has standing. And if you interpret standing broadly, that could include adjacent property owners who could possibly suffer damages. And what the statute requires in order to conduct a virtual hearing is that you obtain consent from people who have standing. So the problem for Meredith is that she could potentially have to go out and get consent from all of the adjoining property owners in order to hold a virtual hearing. She wouldn't have to do that with an in-person hearing. So I think that's the advantage of being able to conduct Board of Adjustment meetings in person so that you're not having to deal with this issue of getting consent from potentially the adjacent property owners to hold a virtual hearing.
That's a good point, Danny.
So I guess one more additional piece of information that I'll add, and that is the most recent executive order exempted governmental activities from the mass gathering limits. And so you can have a Board of Adjustment meeting and have more than 10 people in the room and not be breaking the law. And so I guess the question I have for the board tonight is, if you want to make a townwide policy that all our meetings need to be held virtually for safety reasons, we can do that, but it would put a lot of weight on Meredith's shoulders. And I'm hoping you'll say that it's okay for us to hold an in-person meeting with safety measures in place.
Wilson, would it be possible? I'm sorry, David.
Go ahead, Michael.
Would it be possible? I mean, because I think the biggest concern with any type of gathering for us is if you're looking at our current space in the boardroom, the commissioner's boardroom, it's just lack of being able to get, enough distancing between the members of the board and the public and all of the players. Now, most of the time, beyond the key players and the Board of Adjustment members, you don't really have a room full of people. So, our current situation size-wise would probably be all right most of the time. But just as a contingency, I remember last year when we had the very contentious Board of Adjustment meeting, and we were able to hold it at the Stone Center. That room would allow for more potential spacing, even between the members of the Board of Adjustment. So would that be something that we could look into? Because really, I think Meredith's main concern would be spacing and social distancing to keep all the participants safe. So if maybe just a bigger location might be something to look into.
Yes, sir. We have talked about that. Yes, sir.
That was going to be my suggestion, because we have through the years used the Stone Center, and the school board has been always very welcoming to us, and that would allow people to distance properly, and maybe even a way that we could meet in time on a personal basis, because I do feel like we have better discussions when we're together. It's a bit stilted. It's just a bit awkward on Zoom. And one benefit of having the public meeting is to be able to thoroughly discuss matters. And I feel like we don't always get that done on Zoom, just because we're not used to it.
That's a very good point from Michael and Debbie both. Wilson, this is the mayor, and I agree with both of them on what they just said, and maybe we could do that. As Debbie and Michael, well, at least Debbie said, we have used that facility before, and it works out great. So thanks for that input, guys.
Okay, understood.
Wilson, this is Andrew. I agree with Michael and Debbie.
Okay. All right. So what I'm hearing is that you all don't mind the reconvening the next day for public hearings for our meetings, and that you are comfortable with allowing Meredith to have in-person meetings with protective measures in place, and you'd like for us to look to have in-person meetings as soon as possible.
Yes.
I would recommend.
Listen, I do.
Sorry, go ahead. Yes, sir.
I do have one question, because I mean, I know that you had a statement on there about more convenient for staff and elected officials' calendars. what is the hardship for the staff? Because I mean, I always want to consider staff's, you know, so what is, when you say it would be easier to have the meeting at the next following meeting might be easier for staff? Explain to me why you think that that's easier for staff.
Well, I actually think the opposite. I think that my assumption is that staff have calendared the regular meetings and the workshops and have not made any commitments on those evenings. But I'm not quite sure they've cleared their calendar for tomorrow. And so waiting till the next meeting, I think, would probably be more courteous to them in that sense. But I will say that all our staff are pros, and that typically those meetings don't take very long because you're only taking action on 1 or 2 items. And so I don't think it would be too much of an inconvenience for them. I would recommend that we go ahead and hold our June meetings, our next 2 scheduled June meetings virtually, just because, you know, we're still in phase 2 and we're still trying to take protective measures. But perhaps in July when we reconvene, we can have an in-person meeting somewhere, if that's acceptable to you all.
I'm okay with that. This is Andrew. And also, you know, as far as the public hearing and having to do it the next day, I mean, if we have to do it that way because of a certain issue, I think that's okay. But if we can wait until the next regularly scheduled meeting, then let's just do that, if that makes sense.
I've heard sort of competing preferences then. So if we could just take a sort of a straw poll here, just so I'll sort of know what the consensus of the board is. If you want to have the hearing go into recess and reconvene the next day to take a vote, please let me know, raise your hand. If you'd like to wait until the next scheduled meeting, which could be a month away, please raise your hand.
Is there an in-between option?
There is an in-between option. You know, we could always call for a special meeting, but those require notice, and that's probably the most difficult of the 3 options.
Yeah.
Candidly.
Wilson, this is Jimmy again, and
Yes.
I hate to step on anybody's toes, but we ran into the same stuff 2 days ago with the housing authority meeting, and we decided to go ahead and meet on Thursday and vote on the budget on Wednesday. It took us about 15 minutes to do what we had to do, but I don't know what the consensus of the board is.
Sounds like their consensus is to do a similar thing.
Okay.
Wilson, I'm okay with either. I mean, if Michael and Angela are okay with that, then it's okay with me because I know they have their businesses.
You know, it's difficult for me to do 2 evenings in a row because a lot of times I work in the evenings. But, you know, I'll accommodate it the best I can when necessary.
Okay. Well, hopefully this won't be, but, you know, for a couple more meetings, and when we get back into holding in-person meetings, we won't even have to do this. Now, with that said, we are permitted to hold virtual meetings for as long as the state of emergency is in place. And I think that legally the state of emergency will be in place even when the state moves to phase 3. So I think we'll be permitted to hold them if we want to, even into phase 3.
Wilson, I also have some thoughts about if we do decide to start having some meetings in person at the Stone Center. I still think there's some ways, and I'll discuss it with you and maybe Crystal outside of this. It's just some thoughts that I have about a way we can still engage the public, you know, and maybe incorporate a little bit of the new technology with the old school meeting approach. So just some thoughts I'll have, and I'll get with you on that.
Yes, sir. Thank you. All right. If there's no more thoughts on that, those are the only items I have tonight. If I don't have it on here, but usually the last item on the agenda, mayor commissioner topics. So if there's any topics that any of you all would like to share, to bring up for discussion, please do so now.
I don't have
Wilson,
any. I'm sorry, Debbie.
I'd like to ask about the splash pad. If has work been stopped because of the situation with the virus? Is work going on? Just an update, please.
Well, Nelson was on here a little earlier, but I think he signed off. So the work has not stopped, but it has been moving slowly. There has been some progress made, but we're hoping to use the fact that the pool won't open to complete that in a more timely way without disturbing the swimmers and so forth there. And so we hope that here in the next few weeks that the work can accelerate on that.
Good, that's good.
Any word from Leanne on how the grant application process has been going?
So I might ask Debbie to share her thoughts on that as well. But yeah, I talked to her this morning. I think she said they've awarded 39. She's going around to the various contributing agencies and asking them if they'd be willing to extend the eligibility requirements a little bit to take the eligible businesses up from 15 FTEs to 25. And I told her that I would take y'all's temperature on that. And I was planning on giving everyone a call and seeing how they felt. But if you all are all right, if we can talk about it now. So 39 and still, getting a slow trickle of applications in. But they think that by widening the pool somewhat, they'll be able to help more people. I think 25 is a good number. If you've got more than 25 employees, $2,000 probably isn't going to help you a lot. But, a business between 15 and 25, I think is still considered a small business. And I think it would be okay and appropriate to make those folks eligible as well. And unless there's any objections, I'll probably share that with Leanne.
I'm good with it.
I feel the same way about that, Wilson, because one thing I learned last week when this idea first came up is that these tend to be our food service, hospitality businesses, and they're really critical to the community and our town. Most of them actually have 20 FTEs or less, but she wanted to go ahead and include to 25 just in case. And we really need to thank Andrew for his work last week to, or maybe it was week before now, to get the information out to the business owners. It just takes a lot of work and repetition to get this out to people. And they had a hard time grasping that grant means giving you money that you do not have to pay back. And, that doesn't happen very often. And so people were a little wary of it. But he did a great job of helping to assure we got a lot of North Wilkesboro businesses involved in getting grants. And they're also making plans in case all the money is not requested of how else to sensibly utilize those funds to help our small businesses. And so that will be something you'll probably hear more about. We meet tomorrow morning. I don't know yet how many applications have come in this week, but we are meeting again tomorrow morning to award grants.
Thank you, Andrew, for your work. I'll hold up today's paper. You can see they've got an ad for the program, nice big color ad in today's paper. So hopefully that'll generate some more applications.
Wilson, just to clarify, she also said it's okay. Maybe I'm wrong, but did Leanne say it's okay now for businesses that have one employee instead of two?
Yes.
I think so, yes. Yeah.
Although they still need to have you would not want to include a business that has one employee working out of a home. You want them to have a place of business. With
All right. Does anyone have any other topics that they'd like to discuss?
Just thanks for all you're doing, and hope that everybody stays safe and the staff stays safe as they come back to work. And just want to encourage you to, just try to get things moving again. And we may have to live with this virus for a while, and as normal as we can make things will be good. And on a small note, with the splash pad, with the pool being closed for the summer, it may let the construction guy feel like that some pressure's off, but I would make it clear to him that that's not the case.
Yeah. One of the things that Nelson and I talked about when we were talking about whether to open the pool or not is that A, let's get the splash pad done, and B, we'll do our best to keep it clean so that it doesn't fill up with green water and become an eyesore. So it might not be open, but it won't be ugly over the summer. And so we'll use some of the money that we might have spent paying our lifeguards and so forth to maintain it.
That's a good thought, Wilson.
Mayor, that's all I have.
Anybody else have anything?
Wilson, this is Jimmy again, and I may be overstepping my bounds, but when do you want the fire department to start running first responder calls again?
I guess. Well, are they ready now? Is Wilkes EMS ready to hand off now?
I don't know if they're going to have the. We usually trade off on PPE if we have a call.
Mm-hmm.
I don't know if EMS has the ability to do that right now. I think I got a 7-day supply from what I've been told.
Yeah,
but we'll do whatever.
Let's me and you talk.
We've got plenty at the station.
Let's me and you talk tomorrow morning.
Okay, sounds good.
All right.
Anybody else? If not, I need a motion to adjourn. Did you just make a motion?
So moved, Mayor.
Okay. All righty, all of those in favor, sign off and click off and close your laptops.
Everyone take care.
See all of you. God bless you.
Bye-bye.